Imagine it's the year like 1790, and two men are standing in a field at dawn because one of them had their feelings hurt. They walk 10 paces in opposite directions, then turn around and fire pistols at each other. In movies, they usually make this seem oddly civilized or romantic, but as a doctor, all I see is punctured organs, shattered bones, internal bleeding, infection, and some of the worst pain imaginable. But if you were injured in the era before modern surgery, anesthesia, antibiotics, and blood transfusions, not only were your odds of surviving pretty bad, but your odds of suffering were really good. Today we're talking about the brutal reality of fighting duels. Back in the 18th and 19th centuries, dueling was supposed to be a controlled form of violence. There were rules, witnesses, agreed upon weapons, and formal procedures. But that's a joke because a bullet entering your chest or abdomen causes the same damage whether it comes from a criminal, a soldier, or an offended gentleman with pristine white slapping gloves. On top of that, most dueling pistols were pretty inaccurate by modern standards. Add to that a stressed out, cold, sleep-deprived, angry opponent, and a shot aimed at your head was just as likely to miss you entirely as it was to hit you in the spine, liver, or lung. As you can imagine, the result was often horrific bodily trauma. I think that what makes duels so fascinating is the contrast. The event itself was like a polite ritual acted out between two well-dressed gentlemen, but the injuries were usually the exact opposite: random, violent, and horrifyingly painful. Classic dueling pistols from the 18th century didn't fire bullets as we think of them today. They fired a heavy, round lead ball about this size. These things did not behave like sleek, high-velocity rifle rounds. They were projected much slower than most modern bullets. But slow doesn't mean gentle. When a heavy lead ball hits tissue, it crushes everything in its path. If it hits a bone, it could splinter into sharp fragments that caused even more damage. A shot to the chest could collapse a lung. A shot to the abdomen could injure the liver, intestines, kidney, or major blood vessels. A wound to the thigh could sever the femoral artery and cause rapid blood loss. One of the most dangerous aspects of these injuries is that the victim might initially appear relatively normal. Someone could still be talking and walking while bleeding internally. That's true today, and it was true 200 years ago. The difference is that doctors at that time just didn't have very good ways to identify or treat those hidden internal injuries. Most people think that the bullet itself was usually the thing that killed people fighting duels. But oftentimes it wasn't the bullet, at least not directly. One of the biggest threats was actually just infection. Before the acceptance of germ theory and antiseptic surgery, wounds frequently became contaminated. Clothes, dirt, skin bacteria, and medical instruments could all introduce infection. A patient might survive the initial injury, but then just a few hours later develop a fever. Then over the course of the next few days, that turns into severe infection, and then sepsis, and then organ failure, and then it's pretty much over after that. Today, we would treat these complications with antibiotics, MRIs or CT scans, intensive care, and surgery, but most of those things didn't exist for the vast majority of dueling history. A wound that would likely be survivable today could easily become fatal in the 1700s. The duel itself might have only lasted a few seconds, but the medical consequences could last for weeks or even months. Many famous duels occurred before the introduction of surgical anesthesia in the mid-19th century. If a patient required an operation, they basically had to endure it wide awake. They might have used alcohol or opium to dull the pain, but that's a far cry from modern anesthesia. Surgeons worked as fast as they possibly could because every second just increased suffering. Imagine having a bullet removed, a wound explored, or a limb amputated while being fully conscious. That was the reality most patients faced. Modern surgery depends on anesthesia, sterile technique, blood transfusions, antibiotics, and advanced monitoring. Take all those away, and even a relatively simple injury becomes a terrifying experience. One of the most famous duels in American history was the one between Alexander Hamilton and Aaron Burr in 1804. Alexander Hamilton was the first U.S. Secretary of Treasury and one of America's founding fathers, while Aaron Burr was a prominent politician, lawyer, and the third vice president of the United States. They had been rivals in the New York political scene for over a decade in 1804 when Aaron Burr was running for governor. But Hamilton actively campaigned against him, describing him as unprincipled and dangerously ambitious. Burr demanded that Hamilton either deny or retract these remarks, but Hamilton refused, and the dispute escalated until Burr finally challenged Hamilton to a duel. On July 11, 1804, they met at Weehawken, New Jersey, where Burr shot Hamilton in the lower abdomen. He survived for a little over a day before dying. From a modern medical perspective, it's not really surprising. A gunshot wound involving abdominal organs and the spine is a major trauma emergency. Today, that patient would probably get blood transfusions, emergency surgery, aggressive antibiotics, intensive care, and of course, modern anesthesia. But Hamilton didn't have any of that. His physicians were highly skilled for their time, but medicine just wasn't advanced enough to save him. Movies love portraying duels as quick events with violent chest shots and dramatic collapses. But in reality, the most dangerous wounds were often the least dramatic ones. A bowel injury might lead to infection days later. A damaged artery could cause hidden internal bleeding. A shattered bone could result in disability or amputation. And a spinal injury could leave someone awake but permanently paralyzed. That's what makes dueling wounds so medically brutal. They weren't always clean, immediate deaths. They could produce long, painful, humiliating declines. A man might enter a duel worried about honor, but he might leave it unable to walk, unable to use an arm, unable to control infection, or unable to breathe comfortably. Honor culture was really bad at explaining the recovery phase. Okay, this part is really weird. Apparently, a lot of these duels had a doctor right there on site to manage the consequences. That's ethically strange from a modern viewpoint. Imagine being invited to a field at dawn because two people have decided to kill each other according to some rules of etiquette. You bring your medical bag, you know someone's likely to be shot, and you also know that your presence makes the event feel more controlled and respectable. That's a deeply uncomfortable position to be in, but you have to remember that doctors in that world existed inside the same honor culture as everyone else. Their job was to treat the wounded, not necessarily to dismantle the social ritual. And once the shot was fired, the doctor had to move fast. Check consciousness, look for bleeding, assess breathing, find the wound, determine whether the patient can be moved, try to relieve pain, try not to make the injury worse. Those things sound simple individually, but with limited tools, even diagnosis was difficult. The doctor might not know whether a bullet had pierced bowel, liver, kidney, spine, or a major vessel until the patient lost consciousness or died. One of the easiest ways to understand the danger of dueling is to imagine the same injury happening today. The modern trauma patient is evaluated by emergency physicians, trauma surgeons, anesthesiologists, nurses, radiologists, and critical care specialists. They have CT scanners, blood banks, antibiotics, operating rooms, ventilators, and intensive care units. Now imagine removing like 99% of that stuff. That was the reality facing doctors in the age of dueling. They weren't dumber than us today. They just didn't have the tools that modern medicine depends on. Many injuries that are survivable today were often fatal back then. So the next time you see a duel portrayed as glamorous or honorable, remember what happened after all that smoke cleared. The minute a bullet entered the body, etiquette usually plummeted down the list of priorities. The duel wasn't just a test of courage, it was a bet against anatomy, infection, hemorrhage, and pain. And for most of history, medicine had very few ways to fight those problems effectively. The biggest myth about dueling is that it was a controlled and civilized form of violence. Socially, maybe, but certainly not medically. Thanks for watching, guys. When I was telling my friends about this topic, I noticed that a few of them seemed overly confident that they could win in an old-timey pistol duel. Let me know in the comments if you feel the same way and why. Take it easy, and I'll see you in the next one.